My name's Njeri and I was born in Nairobi, Kenya, and I came to the U.S. in 1989 when I was 13 years old. My father is Kenyan. Unfortunately, he passed away a few years ago, but he's Kenyan, and he came to this country when he was going to college. He went to American University in Washington, D.C. My mother is actually African American, and they got married and moved back to Kenya, and that's where I was born. And lived there with my siblings, my sister and brother, and then in 1989, my parents divorced and we moved to the United States. I remember that everyone smiled a lot, which I thought was a bit strange. And I remember that for so many years, my mother had tried to give us a sense of what it meant to be Black in America, and which is difficult when you're growing up in a predominantly African culture. But she tried very hard. There was a large expatriate community in Kenya, mostly African American women who had married Kenyans, and this was in the 70s or late 60s when there was a big sort of movement among African Americans to rediscover their roots, and a lot of people moved to Africa, and we were part of this strange community, and so we celebrated Black History Month, and so she tried very hard to sort of give us a sense of what that meant, though it was really impossible to really understand it until we came here. So it was very jarring to suddenly not see Black faces and to see a lot of white faces, and I sort of had a sense of what racism was from reading, but I had never experienced it. My mother has always thought education is very important, and so she made sure she tried very hard to get us into very good schools when we came here, even though we had no money whatsoever. And so we applied to like every private school that there was in the Boston area. And I ended up going to some of the best private schools on scholarship. And I don't know if you'd call it a racial experience, but it was an experience where I was very distinctly a minority because of my race and also because of my economic status, and surrounded by extremely privileged children who, some would fly to Switzerland for the weekend, and we were just trying to figure out how to cobble together enough money to take the bus to school. I was in this very sort of privileged space and had access to a lot of resources that I think eventually allowed me to become the person I am today. Well, I'm an assistant professor of cardiology at Yale Medical School. When we first moved here, my mother was raising my siblings and I on her own. She had given up a lot of her dreams when she moved to Kenya. So she had to retrain and eventually got her master's and started to teach in the Boston public schools. But there was a very sort of vulnerable period where she was selling African crafts on the street, and we didn't have much money, we didn't have any health insurance. And we went to a free clinic that was part of, I believe it was Brigham and Women's in Boston. And that's where we got our free, very good health care. And I always remember that. And I remember going to the free dentist and getting my teeth whitened because we had high fluoride content in the water in Kenya, so our teeth were brown. And so that's extremely important to me, to be able to provide similar services. And so I am at Yale Medical, and I have made, I see patients in New Haven, and I've made the decision to do that. I didn't have to do that. I could have gone out to the suburbs. I could have served a different population, but I felt like there was incredible need here in New Haven. And that's what I do, and that is probably that's why I'm a doctor. That's the most rewarding part of my job, is to provide good health care. So I have I don't know if it's the luxury, because part of it is a choice, but I spend time with my patients. I listen to them. I try to go the extra step, and in many ways, even though I'm a cardiologist and I'm specialized and I'm providing heart care, I'm also a social worker. I spend a lot of time trying to help my patients sort of navigate their very difficult social and economic lives, so that they can take care of their health.